Very good. Hi, everybody. I'm Dr. Paul Lieber from Regenexx Pittsburgh. I'm your orthopedic, regenerative medicine and interventional orthopedic specialist. I'm here today to talk to you about a number of different things, but first I'll start by talking about myself. I've been in practice since 1990. I started doing regenerative treatment back in 2008 and joined Regenexx in 2012. And we've been doing lots of regenerative treatment ever since. I'm a board certified physical medicine rehab doctor. I hold supplemental board certification in pain management through the American Board of Medical Specialties. I'm also a cyclist, and I also have received lots of regenerative treatment. I'm 67 years old, and I've been put back together a number of times.
He's not muted. Yeah. Yes. All right.
Can she hear me?
She can hear you.
Just hit from current slide. Okay.
Sorry.
All right.
All right.
Okay, so we're going to talk a bit today. I'll try to proceed, and there'll be space for questions at the end. First and foremost, it's important for everybody to feel comfortable about coming in. We do telemedicine visits, but we also have people coming into the office. All three physicians at this time have been vaccinated. It's likely that within the next month, our entire staff will be vaccinated, which is nice when it comes to feeling safe about the environment. We do social distance. We do wear masks at all times. We clean surfaces repeatedly. We have one person in our waiting room at the time, one person in the exam room, unless you come accompanied. We do take your temperature. We do get a history in case you have a COVID exposure. We want you to be as safe as possible, so we consider this a COVID safety zone. To my knowledge, none of our patients, or few of our patients, have come down with COVID, but not as a result of being here, and none of our staff have had it, and none of our physicians have had it. So knock on wood, we're very lucky, but we make our luck, and we do a good job with it. We have 5 locations, 3 doctors. I'm the good-looking guy in the center, and Dr. Adelsheimer is to my right, and Dr. Sally is to my left. We are all board-certified physical medicine rehab doctors. Dr. Adelsheimer and I have board certification in pain medicine. Dr. Sally is board-certified in sports medicine. We have 5 locations around the area, but we do the mainstay of our treatment at RIDC Park in Pittsburgh. So why are you on this webinar? The most likely reason is that you're having musculoskeletal pain. Your joints hurt, your back aches, your neck aches, and you've heard about regenerative treatment.
Give me 1 second. We're just going to fix something real quick here.
So the important thing is that you want to learn, you want to do different things other than have surgery. You've seen this as the potential future treatment. You may have been told you're not a surgical candidate. You may be on medications. People have told you you're going to have to learn to live with it. You're not ready to slow down, and you want more out of your life. So those are some reasons why people are here. So today I'm going to talk about what is Regenexx. I'm going to talk about the current options in orthopedic care. I will talk some about interventional orthopedics, the Regenexx difference, who this is for, and results of treatment. Well, the future of medicine is biologic. Stem cells are being used in cardiac conditions, in ophthalmologic conditions, really in many conditions. And the idea is basically to shift away from managing conditions to allowing the body to repair itself. We have a vast reservoir of healing factors in the body, including mesenchymal stem cells and platelet-rich plasma. And we'll talk about those today, but they can be harnessed to improve your overall condition and restore you to the activity that you love. So the way the body heals, basically, there's an injury. Let's see if I can do this. There's an injury. I don't know if you can see the pointer on the screen. Signaling proteins go out. They attract stem cells. The stem cells migrate to the injured body part. There are a lot of cells in addition to mesenchymal stem cells that come in. We refer to them as progenitor cells. They proliferate, and ultimately they differentiate. And then you have a repaired area of tissue. In this case, it'd be joint, bone, cartilage, tendon, or ligament. And the natural healing process involves inflammation. You have an injury, you form a clot because platelets extravasate from your blood, come into the area and form a clot. This leads to inflammation. The clot and the platelets have growth factors. They attract cells, including stem cells, which come into the area, and everything relies on inflammation in order to heal. There then is tissue regeneration. The tissues remodel and complete healing occurs. And typically in tendons and ligaments, that takes about 3 to 6 months, and sometimes in bone, it takes 12 to 18 months. And in the case of a joint, what we're trying to do is switch the joint internal environment from one of breaking down to one of rebuilding, and change this scale in your favor so that your joint does not continue to break down. So what I'm talking about is today various regenerative treatments, including stem cells, platelet-rich plasma, platelet lysate, and the granddaddy of them all, prolotherapy. In the case of platelets, they're found in blood. They're small, fragments of cells that are found in the blood. They contain healing growth factor. They speed up the repair of tissue. They also contain a neurotransmitter called serotonin that calms the site of pain down, and they attract stem cells and activate them. There are 2 types of platelet procedures that we do. One is platelet-rich plasma, which we refer to as super-concentrated platelets. This is where we concentrate the Prp to your needs and treat joints, tendons, ligaments, and cartilage. This is time-release growth factors, so healing occurs over the course of several months. And then there's platelet lysate, where we take the platelets that are concentrated from your blood, we freeze them, they rupture, we filter them, and it's pure immediate release growth factor. And it's really good for healing nerves. And we use this for things like sciatica and carpal tunnel syndrome. So Regenexx, Regenexx Pittsburgh, we're really discussing adult stem cells. These are called MSCs, mesenchymal stem cells. They're your stem cells. We get them from your bone marrow. When I use the term autologous, that means you, as opposed to allogeneic, which is from somebody else. And you can't reject you, but you can reject stem cells from other persons. The stem cells that we use are bone marrow derived. They do have what's called an adipose or lipid layer in them. And so we really maximize the stem cells that we're using for you to get the best result. Adult stem cells, they're undifferentiated until they're needed and they're called upon to be used. In the case of our treatment of you, we get them from your posterior pelvis and we implant them with special guidance to where they're needed. And if we put them on cartilage, for instance, they can turn into cartilage. If we put them on tendon, they can turn into tendon. And likewise, if we put them on ligament, they can turn into ligament. They can orchestrate a repair response. They're self-renewing. They speed up the healing process. And they also attract a new blood supply to provide nutrients to the area. So Regenexx. Regenexx is the largest musculoskeletal stem cell provider in the world. In the United States, there are about 65 Regenexx sites. We were number 6. Joined them in 2012. They're the alternative to orthopedic surgery and a pain treatment alternative. We like to say that we're interventional orthopedics. We do things through guidance with the use of needles, not with the use of scalpels. We use interventional orthobiologics, which basically means your stem cells and your platelet-rich plasma, but can also mean other factors such as alpha-2 macroglobulin and interleukin receptor antagonist. And there are others. This is the most advanced regenerative medicine for musculoskeletal treatment that exists out there. And we've become a trusted alternative to orthopedic surgery. So our experience, again, Regenexx has been around since 2005. We at Regenexx Pittsburgh have been around since 2012. We've done thousands of stem cell and PRP treatment, more than everybody else in Pittsburgh combined. And Regenexx has extraordinary amounts of experience since 2005. I think we're up to over 100,000 procedures network-wide. And so we've done a lot. We've done a lot of research and we have great musculoskeletal physicians. And what this does is we're stacking the deck in your favor to give you the best possible outcome. We have specialists, the doctors that are doing this are usually board certified in physical medicine rehab or have sports medicine through family practice. We have a couple of orthopedic surgeons, but basically the background of all of these folks are MD or DO physicians. We don't use nurse practitioners, physicians assistants, or chiropractors. So you're getting a physician here. You're not getting somebody who dabbles in this. We're going to make the right diagnosis and we're going to get you better. Regenexx has done tremendous amounts of clinical research. We have a registry where we keep track of patients, how they do, and we can determine for a specific area what the likelihood is that you'll have success. There are also several randomized, double-blind, randomized, placebo-controlled studies that are occurring to date, including the anterior cruciate ligament study, the rotator cuff tear study, and the intra-articular environmental study looking at what the synovial fluid is comprised of so that we can tell whether you're going to have a good outcome or not. And there are more studies that are coming online regularly. Regenexx has published about 50% of all the world's research in stem cell treatment. When we harvest from your posterior pelvis. We could probably teach the oncologist a thing or two about harvesting. We know how to harvest safely with minimal discomfort, and we harvest in several areas in the posterior pelvis so that we get the most possible stem cells out, the most viable stem cells, and therefore we can provide your injured body part with the appropriate dose of stem cells. And interestingly, and I just heard a talk from Peter Marks, who's one of the heads of the FDA recently, and we are considered to be FDA compliant, and we are the only method of extracting mesenchymal stem cells that are FDA compliant. So it's important for you to know that as we proceed. Finally, we're really have a holistic point of view. We're looking up and down the kinetic chain to see what's going on with you. I'm not the hip guy or the knee guy. I'm the everything guy. We're looking at your structure. We're looking at your symmetry. We look at your joint articulations, and we look at your neuromuscular system. It's quite often that the imbalances that occur because your nerves are undersupplying your muscles, which cause an asymmetry. We're going to treat that as well. The good news is that most of the time we can get away treating you with platelet-rich plasma. 20% of the time you need stem cells and PRP. And typically the differentiation is with mild arthritis or a mild tendon or ligament tear, PRP works great. If things are moderate to severe, then we're going to treat you with stem cells. We have the largest safety paper in the world at Regenexx. We've done about 3,000 patients. The biggest safety issue is pain at the injection site. You're going to have pain at the harvest site, perhaps for a half an hour to a couple hours, and pain at the joint, usually for a day to a couple days. And that's really it. You don't have issues with infection or rejection or blood clots or anything like that. These are needle injections under guidance, and they're very safe. And we treat all sorts of conditions: arthritis, tendonitis, torn ligaments, meniscal tear, spine pain, sciatica, disc issues, nerve damage, and bone damage. And we can treat these either with platelet-rich plasma or stem cells. And again, the areas that we treat are shoulders, elbows, wrists, hands, hips, pelvis, knee, ankle, foot, spine, and even temporomandibular joints. So the current state of orthopedic care is to give you some non-steroidal anti-inflammatory, some ice, tell you to rest it. If that doesn't work, we move on to opioids. And in the knee, we can, or in the joints, we can inject steroids. If that doesn't work in the knee, we can inject a rooster cone, viscoelastic supplement. We can burn the nerves. We can brace you. We can send you to chiropractors. We can do acupuncture, physical therapy, etc. And ultimately, when things fail, as we're not rebuilding tissue, you're going to head to surgery where we remove tissue, where the surgeons remove tissue. I certainly don't. They provide some repairs and ultimately joint replacement. So, you know, as time goes on, what we find is that surgery is going to be less and less predominant for musculoskeletal injuries. The best example of this is meniscal repairs, where when you remove part of the meniscus, you create abnormal biomechanics in the knee wears out sooner, and you head to the orthopedic surgeon for a joint replacement. Most meniscus injuries or slap tears of the shoulders or acetabular tears of the hips can be either treated with stem cells or PRP. So the idea is to stop cutting things out, stop hastening your demise, and to inject orthobiologics to rebuild you. And this is a new specialty, interventional orthopedics. We deliver orthobiologics with special guidance. You can see the ultrasound machine on the left and the fluoroscope on the right. Again, the goal is to do less invasive treatment so you can avoid more invasive surgeries. When it comes to stem cell accuracy, about 50% of the doctors do blind injections into the knees, into the joints, et cetera. And then you have low accuracy guidance where they'll use ultrasound or fluoroscopy and put it into the knee or the joint. And then about 5% of the doctors who do this, myself included, we try to inject whatever is causing instability. So we inject into the joint, but we also stabilize ligaments, tendons, and do tissue repair based upon your needs. And we guide the needle into those areas. And that provides the best outcome because we're being precise and accurate. So I'm going to talk a lot today about knee. If you saw my blog post on Regenexx Pittsburgh, we talked about joint replacement, so we'll delve into that. But I wanted you to know that we treat everything in the knee, from osteoarthritis, especially bone on bone. There's a very favorable outcome. We can treat anterior cruciate ligament tears non-surgically up to 1 centimeter separation with a very favorable outcome. And we can treat meniscal tears, those that don't catch and lock, and have, again, a very favorable outcome. And it doesn't matter whether you're young or old. Though in young people, meniscal tears typically are treated with platelet-rich plasma, and that's all you need. And what we found is that there's no association between age and the outcome of your knee treatment. There's no association between the weight and the outcome of the treatment. There's no association between the degree of arthritis and the outcome of your treatment. But for people who have arthritis all over, they don't do quite as well. There are 11,000 or more patients in the data bank. 2/3 of the people that have had knee treatment report at least 50% improvement at 6 months, and they go on to continue to improve to 80 to 90% by 4 years. There is, of the people who are sent to Regenexx for a knee joint replacement, they've been told they need a knee joint replacement at 2 years, only 12.7 of them have taken the plunge and gone for the knee amputation. The rest are satisfied. That's 87.3% are satisfied with their regenerative treatment. So let's talk about knee replacement versus Regenexx stem cell treatment for knee osteoarthritis. First of all, you're getting your body part amputated. Do you really want that? It's general surgery, so you have to undergo the risks of sedation versus injection, which can be done under local anesthesia. You can see the injections that I've done on the patient's knee down in the lower picture. Much more pain, delayed return to activity and work, restricted mobility. I've never seen somebody with a knee replacement get more than 120 degrees of flexion, and usually it's more like 90 to 100 degrees of flexion. So you can't get your knee under you. It's going to be harder to get up. You're going to have long-term rehab, and you're going to need a knee joint revision, sometimes quickly, sometimes many years down the road, but ultimately, unless you're in your 80s, 90s, or 100s, you're going to have your knee replaced, which involves removing the prosthesis, cutting down your knee further, and putting in a new prosthesis. So this is on my blog post. It's sort of a timeline. So I think with the pandemic, this is a really good time to renew your body parts and regenerate them. And so let's talk about your knee versus total knee arthroplasty. Obviously, they can both be done quickly, though typically with total knee arthroplasty, you're going to be in the hospital for a couple of days with the Regenexx treatment. You're up and around the next day with a knee replacement, simple, uncomplicated. You may not be up and around for a couple months, and with a complicated knee replacement, this may be extended until the summer. By mid-May, you should be doing well. You'll be able to resume strenuous activity with the Regenexx stem cell treatment. Unlikely that will happen even with an uncomplicated knee replacement. You're looking to spring, and if it's complicated, see you next year. So things happen much more quickly. I'll talk about a case study now. Susan's a 68-year-old retired nurse. She underwent a left hemiarthroplasty. They replaced part of her knee in 2014. She had severe pain in that knee, and she went on to have severe pain in the right knee. She underwent the Regenexx stem cell treatment with us about a year ago. She's 90% improved, and I've been treating her left knee with platelet lysate hydrodissection to dissect the genicular nerves and free them up. And her right knee is about 80% better, and she's returned to all desired activities at this point. Julie is a lady who had avascular necrosis. What's that? A dead bone. She developed dead bone in her knee. This was a plague, severe pain, and she had 21 years of knee pain. She had 4 arthroscopic surgeries. She also developed psoriatic arthritis in her 20s. The avascular necrosis was something that happened to dead bone in 2012. She lived on pain medicine and crutches. She couldn't do any of her activities, including she was an avid teacher of yoga and plyometrics, Pilates, things like that. She couldn't do it. She underwent the Regenexx stem cell treatment in January of 2015. You can see that it worked. The hole in her knee had been reduced. The health of the surrounding tissue is much greater. She stopped having knee pain and has done well. Back to a normal lifestyle. So good stuff. Let's talk a little bit about ACL versus what we call the Prp ACLR, which is the regenerative treatment of your anterior cruciate ligament. The alignment of the allograft typically that's surgically placed is non-anatomic. And as such, they just can't make it exactly right because they're not using a twisting two segmented ACL, which is what you naturally have. They put in one either they take a tendon out of you, or they use something that's been manufactured and put it in there. And as a result, your knee doesn't move normally. And again, it's a setup for premature arthritis. You're going to have prolonged immobilization with their treatment. You'll have no immobilization with our treatment, though you will wear a brace. You're going to have prolonged rehabilitation. Typically, it's 6 months or more with a knee replacement. Typically, it's 3 months with what we do. And again, you can have graft rejection and graft failure. David is a fellow who is an athlete who underwent the Prp ACLR procedure. He had torn his lateral meniscus skiing and underwent meniscal surgery 7 years ago. He then was playing soccer and had a partial tear of his anterior cruciate ligament. He underwent the Prp ACLR procedure in 2019 and has had radiographic evidence of full healing of the anterior cruciate ligament. He's 85% better He's returned to all activities except soccer. Though he does referee soccer, he can run and ski, etc. And this is what his knee looked like. This is not David's knee, but this is what it looked like. You can see that there's lots of disorganization, and there is a tear down here. And this is David's story also. About 6 months later, you can see this dark and healthy ligament. There's a little ditzel here, but it has not interfered with his function. So for all of the treatments, not just knees, we have good outcome. There's less pain. You have increased function. Your mood is better because you don't hurt as much. You're off your pain medicines. So that's good. And you're back to your preferred lifestyle and doing what you love. So who can you trust? I'm hoping that you can trust a physician. I'd like to earn your trust. Physicians are the folks who should be doing this. You've probably heard about other types of treatment, amniotic, placental, cord blood, Wharton's jelly. These tissues are touted as stem cells. There's not a single live cell. We at the Interventional Orthobiologic Foundation have tested as much of this pseudo stem cell as we can, and none of it grows tissue. So that's important for you to know. It's tissue, it's not cells. The other thing that's touted often by folks who are doing the amniotic or placental is to tell you that your cells are too old. We've treated people that are 100 years of age and gotten them back to function. So it's not true. You have less stem cells, but you certainly have enough to treat one large joint effectively with your cells. And we get these people back to doing the activities they love as well. So you got to watch out for people who are discounting or heavy emphasis on financing. This is not a magic cure-all. Everybody doesn't get better. Everybody is not a candidate. Watch out for people who are calling the amniotic, the cord blood, the placental, and the Wharton's jelly stem cells. They are not. And fat, according to the FDA, is outright illegal. You can't, when you do fat-derived stem cells, you're taking fat from the body and you're washing it with an external agent called collagenase. And when you do that, you are, according to the FDA, making a drug, and they come by and they tell you to cease and desist. So our stem cell treatment is a three-part treatment. We do dextrose prolotherapy. And all this, by the way, is done under guidance, either ultrasound or fluoroscopy. First part is prolotherapy. We strengthen and tighten ligaments, and we irritate the surface of your joint that we're going to inject the stem cells on. The second appointment, we harvest from your posterior pelvis in 3 or 4 locations on both sides. And again, this can be painless. It doesn't cause pain. We know how to make this not hurt. And then a couple hours later, once we've taken this to our lab and concentrated it to the degree that we want for you, we implant. And we implant under ultrasound and or fluoroscopy. And finally, your third appointment, we give you more platelets. We take them from your arm, concentrate them, and we jazz those stem cells and tell them to work harder for you. With platelet-rich plasma, it's a little different. You're going to have initial visit. In both cases, you're going to have initial visit, an hour examination. We're going to draw your blood, and we're going to inject the blood draw and injection the same day. We'll prescribe physical therapy, and typically that is necessary. And we'll follow you at 1 month, 3 months, 6 months, and 1 year. The initial visit, again, with stem cells is 1 hour. We're going to examine you. We're going to review your diagnostic studies. We'll order diagnostic studies for you if we think you need them. We'll do an ultrasound examination as well. and we'll make a recommendation. Then we'll see you back to do that prolotherapy, which we refer to as tilling the soil. Second day is planting the stem cell seeds, and the third day is fertilizing the stem cell seeds. Typically, we can get this done in 5 days. Over the course of a week. We then prescribe a month of physical therapy. Some people go on to do more because they are getting their repaired joint or repaired tendons, whatever, back to function, and they're liking the therapy. We see one month, 3 months, 6 months, and 1 year. So post-care physical therapy is typically less than a joint replacement. Typically about 60% less than surgery. There are folks that do special types of treatment like pedagogoscopy. You can actually do it yourself if you're skilled at this, or your referring provider can treat you. Insurance coverage. The good news is that we have a corporate program and that we probably have somewhere between 12 to 15 million covered lives. Self-funded employers buy into having their employees undergo the Regenexx treatment, either stem cell or platelet-rich plasma, and there are lots. And classically, in a self-insured employer of about 500 employees, they're going to save about $2 million compared to the comparable orthopedic surgery over the course of a year. People are happier that they don't lose their body parts, and they go back to work in about a third the time. So this is how it stacks up cost-wise. Sadly, your insurance doesn't pay for this right now. These are ranges. You can see stem cells are certainly the most expensive, but we work with you to make this happen. And there are programs out there to work with that will help get this covered for you if you don't have the money at the time. So who's this for? It's for lots of people, but the people who want to avoid surgery, keep all their body parts. They don't have downtime for a lengthy rehab. They don't want drugs. They want drugs out of their system. Some have failed, like Sue, have failed surgery before. They know somebody with a bad outcome, and maybe they have a medical contraindication, or they're too young for surgery. Insurance covers consultations, follow-ups, diagnostic studies, bracing, and therapy. It does not cover the regenerative treatments, but with co-pays and deductibles, you actually may be paying more than with a traditional orthopedic surgery. Remember, we're going to customize your treatment for you. This is not one size fits all. This is not everybody gets stem cells. We look at you, we look at your diagnostic studies, and we customize your treatment plan, and we work with you to make it happen. This is a great time to do treatment because some people are not as busy at work, some people are at home. Again, we're a COVID safety zone, but when the pandemic is over, you can be ready to do that activity that you love. We have 5 locations again. We all work out of Pittsburgh, which is where we have our lab, the fluoroscope, and the ultrasound, but we have offices in Sewickley, Monroeville, Bridgeville, and Washington. And if you're interested and you can schedule a consult, you'll get a consult with a physician. Call Sarah Furlan at 412-963-6480. She'll put you on our schedule. Remember, your insurance will pay for this. Usually, sometimes there are co-pays and deductibles, but it's certainly a way to be assessed. So with that, I am going to try to figure out how to answer your questions. And see if there are questions that you want to raise. So if anybody has any questions, I would be glad to answer them, but I'll start by trying to anticipate some of the questions you might have. First, we are FDA compliant, but no treatment at this point, nor will it be, is FDA approved. FDA approves procedures, they approve they approve devices, and they approve drugs, but they don't approve procedures. So we are compliant, and that is about as good as it gets. And we're the only stem cell treatment that is FDA compliant. So Chad, you asked, you're a jogger, how long after treatment can you resume jogging? Typically, the answer is somewhere in the neighborhood of 4 to 8 weeks. If you're an avid runner, I would say that you will be probably somewhere around 3 months. So Amir asks, what about placental treatment? Is it real or fake? The answer is that it is neither. It is not real stem cells, but there are placental tissue treatments that are helpful. I don't have a lot of experience with placental treatment. I've done a very little bit of it. I can tell you a friend of mine who's a cyclist in Florida had a placental treatment, and she got about 3 months out of the treatment. She had it for her knee. She's gone on to have regenerative stem cell treatment down in Florida. And I haven't heard how she's done, but typically the stem cell treatments last for years and years. Joseph Gatos asks, I'm sorry, Joseph, is an MRI needed? And the answer is an MRI is typically needed for spinal issues. It doesn't have to be done for peripheral joint issues, except in special circumstances. So if I think that you have an anterior cruciate ligament tear, I can't see that under ultrasound. I'm going to need to get an MRI to look at that. I can gauge your rotator cuff tear under ultrasound, for instance, if I think you have a rotator cuff tear of your shoulder. If it's your hip, I can see some of the labral tears under ultrasound. If it's a shoulder, it will be difficult to see a labral tear, and I would need to have an ultrasound if that's, an MRI if that's suspected. So Ken asks, what's the cost per knee? So the answer is it depends upon what's being done. If it's PRP, let me see if I can go back to that. So if it's PRP, this gives you a range. And if it's stem cell treatment, this gives you a range. We don't typically do 2 knees at once. And the reason being that we're robbing Paul to pay Peter. We want to give you the ultimate amount of stem cells to give you the best possible result. We look for at least 400 nucleated cells. We have an automated cell counter when we do this procedure. and we count the nucleated cells. And if you have less than 400, I'm sorry, I said 400,000, it's 400 million, then we worry that we're not going to have enough in the dose. So unless it's strictly what we call patellofemoral chondromalacia, we're gonna do one knee at a time. But sometimes with chondromalacia patella, we can do both knees at once, but it's a rarity. Chad then asks, can PRP help with a sacroiliac joint? So the answer is absolutely. We can inject concentrated PRP into the joint itself. That will help the cartilage, help the joint synovium, and attract stem cells into the area. We also will stabilize the joint by injecting the ligaments. Some of us inject the joint under ultrasound and inject the ligaments under ultrasound. Some of us inject the joint. I inject the joint under fluoroscopy, and I inject the ligaments under ultrasound. So the idea is to provide renewed cartilage surface for the joint, stabilize the ligaments. So I'd be glad to answer any other questions if you have them. So Amir asks, can you use the treatment for adolescent players' injuries? Yeah, so we treat young people all the time. I'd like to treat young people more. We see the sports injuries they have. The good news is that they heal much more rapidly than the octogenarians. And so typically we're getting away with one treatment with platelet-rich plasma. I can't recall using stem cell treatment on an adolescent sports injury. So it's a rarity. Usually PRP is enough. So Chad, you're welcome. And I look forward to seeing you. One of the other things that I wanted to address that I didn't address directly, and that is my belief as to when insurance companies are going to start paying for this. I think that it's going to happen in the next 5 years. I don't know when. And I think that actually Regenexx is going to be the entity that makes it happen. And when I say that, self-insured employers go through insurance brokers, and these are the same insurance brokers that provide regular insurance. And my suspicion is when there is a sufficient number of covered lives through self-insured employers, and my guess is that that's going to be 30 to 40 million covered lives, that the insurance brokers are going to approach the insurance companies, letting them know how viable this is and that they can save a lot of money. And when that happens, I think that this will all get covered. So, but right now, we're doing the best we can. I'd be glad to answer any other questions. Anything else you have. It's been a pleasure to talk with you today. And if you're out there or your friends are out there, in my mind, despite the fact that we have a pandemic, this is the ideal time to get your treatment done when you're not as busy. You may be at home. We are a very safe environment, and you'll be ready for your summer activities, whether that be golfing, gardening, jogging, walking, riding a bicycle, hiking. I think you'll be ready for that. And the skiers, I I guess we'll look forward to approaching you sometime next summer to get you ready for ski season. Anyhow, thank you so much. It's been my pleasure. And I wish you all the best and good luck in health, safety, and regeneration. Thanks so much and have a great day.